You all see the slides? Yeah?
Yeah.
Yeah, you can all see the slides, yes?
Yes.
Okay. So, morning, everyone. My name is Shazia Khan, and the unit we'll be doing today is effective communication in health and social care. And we'll be looking at learning outcome 3 today, which is to understand barriers to communication. In the last session, we looked at learning outcome 2, which was to understand the communication needs and preferences of individuals. We looked at what communication is. We also looked at the effective features of communication, and we looked at the theories of communication. So we had, does anyone remember any of the theories we looked at in the last session? No? Remember linear, interactive, and transactional.
Transaction and active mode. Yeah.
They were the three. They were the three main theories of communication which we looked at. We also looked at what the effective communication is in how we promote effective communication. So through like verbal. What's verbal? What can be verbal?
Talking to each other.
Talking to each other.
Yeah. And what's non-verbal?
By using signs or
touching, things like that. Okay, so that's more body language. And then we looked at what active listening was. We also looked at written communication and the importance of written communication, and the use of interpreters and advocates we looked at in the last session, and communication aids such as symbols, brailles, pictures. We looked at what Makaton was, and we looked at the resources available for communication. So that was learning outcome 3. Now, sorry, 2. Now we're going to go on to learning outcome 3, which is looking at barriers to communication. When we talk about barriers, what do you think barriers can be?
What can affect communication?
Excellent. What can affect communication? So, there can be different things that can affect communication, and we're going to go through each one. But give me an example of what you think that may affect communication.
When you are not concentrating, when you are dealing with your client, when he's talking to you and you are not, it's like you are distracted. You are distracted.
Why do you think when you're not listening, why does that affect communication?
Because that means your clients will think you are not concentrating or you are not ready to listen to what he's telling you.
And why do you think listening is so important?
For understanding.
To understand them, to know what they want. If it's medicine, if it's anything to do with any sort of medication, or if they need help going to the toilet, you need to be able to understand them. And it is difficult. It's not an easy job to understand some people. And that's the barriers to communication. So learning outcome, the indicative content. So we look at barriers to effective communication, language being a really big barrier as well, ethnicity, culture, the environment, skills, ability, disability, noise levels, distractions, sensory awareness, terminology, well-being, mental well-being, and how to overcome these barriers to effective communication. For example, like you just said, effective listening skills is a big one. Use of adaptations, aids, advocates, interpreters, active communication skills, the use of body language, appropriate environment, building trust, meeting communication needs, safeguarding and confidentiality. Why is the environment so important?
Because when the place is noisy, it can be a factor. The person cannot hear you.
Yeah. And also, you need to make that person feel comfortable, don't you?
Yeah.
Yes. So you need an environment where they feel comfortable, they can talk to you. So here's a video on barriers to effective communication, which we'll watch now, but I need to, I'll stop sharing that, and then just 1 minute, because then the volume doesn't come up, so I'll share that. Right, you can all see this, yes, the video. And now I'm going to put it. Can you hear it?
Preparation, knowledge, or skill. To prevent
Yes.
personal barriers, you should plan what you want to say.
Yes.
Yes, that's fine.
Excellent. Yeah.
Barriers to effective communication come from 3 sources. There are personal barriers, which come from you. These often result from a lack of preparation, knowledge, or skill. To prevent personal barriers, you should plan what you want to say in advance. Make sure you understand the information so you can relay it with confidence, and make sure that you use tools and equipment that you know how to use. For example, you should make sure that you're familiar with PowerPoint software before you begin a presentation. Then there's social barriers, which come from other people. They might include the knowledge or skill level of whomever you're communicating with, their thoughts, feelings, or preconceptions about you, and whether there are any cultural or language differences which might cause confusion. The best way to overcome social barriers is to know your audience and use language that allows them to understand you. For example, avoid using jargon or slang. And there are environmental barriers, which tend to be distractions, errors, faults, or really anything outside of you and whoever you're communicating with. Potential environmental barriers include noisy offices, poor internet connections, or badly printed photocopies, among other things. This is why the right place and the right time are key considerations for effective communication.
So you can actually see from that video the different barriers to communication. Can you see the slides now? You have to come back.
Yes.
Yeah.
Yes, excellent. So you've got things like, social, personal and environmental, and these have an impact on someone's life, and they have an impact on how you communicate with with people, be it like maybe a doctor, a nurse, a patient. You should be able to communicate effectively with that person. So barriers in communication. In a health and social care role, you will meet many people, many individuals, and many different barriers to communication. Individuals from different backgrounds may use communication methods in different ways. Things like social background, culture, age may affect communication. Why do you think age is a big thing that may affect communication?
Because the more you are aging, some individuals have to use hearing aid because they get age loss, or they have to read from your mouth before they can.
Yeah. Do you think that it's sometimes difficult to communicate with elderly people?
Yes.
Yes, sometimes, yeah.
Why do you think that's so hard?
Because they can't easily understand.
Yeah. They can't always understand, can they?
Yeah.
So it's sometimes when you're talking about medication or what you want them to do, it's very difficult sometimes for them to understand. And an example we've used in barriers to communication here is an individual who's a foreign language speaker may use more gestures to communicate with you rather than language. So some cultures naturally use more movement and gestures as they speak. Another individual may be hard of hearing and may need to be able to see your face in order to lip read. So, there are different barriers. Language is a big one. Language is a big one within the health profession, because people are not able to understand certain jargon. Then the foreign language as well, their first language may not be English. Barriers to effective communication could include noisy environments. So if individuals are easily distracted, affected by loud noise, or have some hearing loss, noisy environments may make it difficult for them to communicate effectively. Uncomfortable environments such as poor lighting or heating. These can be distracting if the person is in the environment for a lengthy time period, and poor lighting may mean they cannot see, for example, if you're using sign language or lip reading. Lack of privacy within an environment. So much of the information shared in a health and social care setting is confidential. So individuals and their family and carers may not be happy discussing issues environment where they feel they might be overheard by others. This may mean that they do not give full information or say what they really. So what should you do if you feel like, you know, the person needs, you know, some space and you need to talk to them confidentially? Where should you take that person?
To the family room or to the office?
Yeah, to the family room or the office, or maybe a quiet area where they can discuss everything quite freely, you know, and give you all the information. Because it's sometimes people, when they're talking in a huge environment, and it's not just in the healthcare profession, it's any profession. You know, I have students that come and see me, and sometimes, you know, they don't like talking in the common room. So I have to take them to my office. So, you know, everything's personal and confidential, because it's very difficult for people to tell you everything in an open space. A lack of understanding or awareness of individuals' needs, wishes, beliefs, and values. Where people do not have any understanding of the individual and what they want, this can be a barrier to communication. The individual may feel resentful and undervalued, and the care solutions discussed may not be appropriate. So, you know, where they've got lack of understanding of anything, their beliefs, their value, you need to be there for them to support them. Cultural differences or preferences. Cultural differences or preferences is communication that are not understood or are ignored, may mean that the communication is not as effective as it could be. We used the example previously of some cultures seeing too much eye contact as disrespectful. This will affect the sharing of information. What kind of other cultural barriers do you think there are?
Language.
Language, yeah, but what else could be a cultural barrier? So it's just some communities believe
Dressing.
yeah, dressing, but some people just, do you know some communities, they believe that giving blood tests is not part of their religion?
Yes.
Yeah. So you need to, would you need to respect that person's beliefs and religions?
Yeah.
You do, but sometimes, you know, if someone is really poorly and they need their blood tests and they need things like that doing, it's very hard sometimes to, you know, bear in mind that these cultures are preventing that person.
Yeah.
It's difficult because, you know, you've got to look at the, you know, well-being of the person, but then you've got to understand their culture and their, you know, religion as well, because it's so important to them. And at the forefront in the health and care profession, the forefront should be that you take care of the individual, don't you? That's your main priority. So you've got language barriers, and this is when individuals are not able to speak the same language or have limited language skills. This will affect communication, and this is a big thing. You know, sometimes you've got people from different cultures that are not able to understand the language. They're not able to understand the, you know, the nursing jargon or the healthcare profession jargon. So, you know, you should be able to speak to that person to make them understand, provide them an advocate or an interpreter to help them understand. Poor use of unavailability of communication aids, such as hearing aids or hearing loop systems. So if communications aids are not available or working effectively, then people will not be able to communicate effectively. The use of jargon or slang terminology, which is not easily understood by others. So jargon and difficult terminology, for example, medical terms, like I've just said, are difficult for non-specialists to understand. Sometimes people will not like to ask about their meaning, so understanding is lost. So why is it important for you to speak in plain English to the individual?
They'll be able to understand what you are passing to them.
Yeah, and why is that so important?
So that communication will be complete.
Yeah,
because if the other end doesn't understand what you're really saying, the communication is not complete.
Good. Communication needs to be complete, okay? And they're able to understand what you're doing. For example, if you're giving medicine or if you're going to provide them any sort of treatment, you know, you need to explain that to them in not in medical terms. Why do you think it's not important? Why do you think it's important to not talk to someone in medical terms if they're a patient?
For not talk to them. Can you say the question again, please?
Yeah.
Can you say the
Why do you
question
think
again?
why do you think it's so important not to talk to patients in medical terms?
They might not understand what you're saying.
Yeah, they're more likely to not understand what you are saying. Okay, because they're not medical experts.
Medical line.
Yeah, so you need to be very careful, and especially, you know, if you're talking to people that are elderly, you know, they need to be able to, you need to talk to them a little bit more, maybe explain sentences a couple of times rather than just the once.
You have to say it again and again.
Yeah, you do. Yeah, sometimes.
Because they can't process easily.
Yeah, you know, I used to do that with my dad. I used to sometimes have to talk to him so many times for him to understand, and he had dementia, and you know, it was very difficult to talk to him, you know, culturally, but also try to make him understand why he needs to take this medicine, what's the medicine for, because, you know, when they become old, their minds become like children. They kind of think, you know, so you have to explain things so many times to them. The individual's condition may present a barrier to communication. So, for example, you know, someone who has problems with speech or hearing impairment, dementia, as I've just mentioned, autistic spectrum conditions may prevent the individual from receiving or understanding what is being said. So you need to be very clear. An individual's attitude may prevent communication. For example, if they're aggressive or withdrawn, distressed or emotional. So if they're upset, you know, and if they're aggressive about, you know, finding out they've got an illness or anything, you need to be more understanding. Your own attitudes, feelings, values, and beliefs can present a barrier to communication, especially where you have negative feelings towards the individual you're communicating with or have very different values and beliefs. That should not be part of you, you know, that should not be a reason for you not to treat an individual. You shouldn't bring your own feelings and beliefs into work, should you really? Because, you know, it's, for example, I'll give you an example. In my profession, I teach law, but I also practiced law for 12 years. And if there was something I didn't agree with, okay, I wouldn't, you know, I wouldn't bring that into my profession, because that would mean that I wouldn't be able to represent the client properly at court. I wouldn't give my whole, you know, 100% passion in that and represent that client. And it's unfair on the client. So, you know, you as a professional need to, you know, disregard them barriers in regards to things like, you know, that their beliefs might be different to yours. Because in this world, we are all different. We have different beliefs, we have different understandings, we have different values. So, you know, so it's really, really important to identify, you know, that you are able to, you know, accept the different values and beliefs. You may not agree with them, but you might accept, you have to accept them. Okay. And sometimes, you know, I was watching this documentary on doctors and things, and there was, you know, I think it was a Jehovah's Witness family that came in, and their son had a tumor, a young boy, he had a tumor, and they wouldn't let him have blood tests or anything. And they said that if he doesn't have these blood tests and we don't do the surgery and things, then, you know, he will die. And the family said no, because our belief is that he will have no medical treatment. So the young boy was 10 years old, and then he came back to the doctors himself when his parents weren't there and said that I want my treatment. Even though he was 10, he didn't want to die. So, you know, he wanted the treatment. But parents are very strict in them, and you know, even though my beliefs and values wrong on that, you know, but I couldn't say that. But sometimes, you know, you have to say something as well. And the doctor actually did. She said, you know, that he will either die, and then the mother accepted it, but the father still didn't accept it. So it's difficult sometimes. 3.1, explain barriers to effective communication. So effective communication in health and social care is paramount, but various barriers can hinder it. So understanding these barriers is the first step towards addressing and overcoming them. Here's an explanation of some of the common barriers. So physical barriers, and that could be things like noise. So it's loud or constant noise can make it difficult to hear and understand spoken words. Sorry, that again. And distance, if individuals are too far apart, they might not be able to hear each other. And poor lighting, you know, like we mentioned earlier, inadequate lighting can affect non-verbal communication, especially if someone relies on lip reading or sign language. Environmental distractions, overcrowding, or frequent interruptions can hinder effective communication. Physiological barriers, which would be things like hearing impairments. Difficult hearing can obstruct verbal communication. Speech difficulties, conditions like stuttering can affect one's ability to communicate verbally. Visual impairments, this can affect the ability to read written communication or perceive non-verbal cues. Cognitive impairments, and these are conditions like dementia or learning disabilities, might affect understanding or expression. We've got psychological barriers, stress and anxiety. You know, people that have stress levels and anxiety, it may affect it. High levels of stress can affect concentration, making it difficult to listen or communicate effectively. Low self-esteem. So a person who has low self-esteem might avoid communicating due to lack of confidence, because they don't have any confidence to talk to anyone. Prejudice, so preconceived notions or biases can lead to selective listening or misinterpretation. Language barriers, so these are like different native language. When people speak different languages, they might not understand each other. Jargon and technical language, using specialized terms can be confusing to those unfamiliar with it. Cultural barriers, so different cultural norms, like we talked about. Cultures may have different ways of expressing emotions, different non-verbal cues, or different norms around topics like eye contact. Cultural stereotypes and prejudice, misconceptions or biases about another culture can obstruct open communication. Has anyone had issues in their profession where they've had issues with culture? You know, any sort of cultural barriers?
No.
Has anyone? No, you've not had any issues with anyone in regards to any sort of cultural barriers?
No, personally, no.
No. Anyone else? No. It's sometimes quite.
One time there was a patient that came, and she said she because of her religion she prefer a male a female doctor.
Yes.
So even though most of the doctors were busy, they have to wait. So a female doctor that I was with have to finish with that patient before we went to see. And even with the female doctor, somebody have to be there. So they have to call me to be there to just stand there and just watch well, because he needed to examine.
That's
the
quite
female, because the patient recommend like asked for a female doctor. The doctor was like, he's not competent being there alone with her, so somebody have to be there. So she have to explain to her that yes, I'm here just to see what they are doing.
Yeah, that's quite common though, isn't it? Where sometimes they want, and especially it's mainly sometimes within the, not predominantly fully within the Muslim community, but it is mainly within the Muslim community where they want to see a female doctor, you know, and that's because of their cultural views and their, you know, acceptance of the fact that if they're going to see a doctor, it has to be a female.
So yeah, it's opposite side. If they are male, they need to see the male. They want male to deal with them.
And sometimes men also want to see male doctors.
The men, they want to see male doctors.
So I think it's just a personal preference, but also a cultural preference as well.
Even if you want to care for them, they don't want ladies, or they don't want men. If they are men, they don't want female. They want.
I mean,
male.
I sometimes for personal issues, I think sometimes if I ring the doctors, they always say to me, "Would you like a female doctor and a male doctor?" Which is quite nice. But you know, for just general health conditions, I'd go see a male. But for personal health conditions, I think sometimes you feel a bit more reluctant seeing a male.
Comfortable with yours.
Yeah. I think that's important though, because if you feel comfortable, you're able to express everything, aren't you?
Yeah.
It's important. Systematic barriers, and that's things like the hierarchy. So in some settings, you've got still strict hierarchical structures might prevent open communication between different levels of staff. What do you think that can be? Strict hierarchical structures might prevent open communication between different levels of staff.
What does that mean?
So you could have different levels of staff. So what level? So you have management, and then you'll have, like nurses, healthcare professionals.
The supervisors,
Yeah, so you can't openly talk to a manager, can you, about certain stuff that you would talk to your colleague about. So that could be a barrier. Lack of training. So staff ain't trained in effective communication techniques. They may not be able to communicate optimally. Inadequate resources. So not having access to tools like translators, hearing aids, or communication boards can be a barrier. Attitudinal barriers. Lack of interest, relevance. If someone feels the communication isn't relevant to them, they might not pay attention. Sometimes you get people that have an attitude when they're talking to you. And resistance to change. People might resist new information or ideas if they're set in their ways. And I remember when, because I used to work for an organization where I'm still the chair for that organization. And I remember there was some staff members we had there that were quite resistant to having these COVID tests. When you come into your employment, when it was COVID, they made sure you had a test every day. And there were some people, and a bit of it was culture, but a bit of them was being resistance. They were being resistant. They didn't want to have the test just because they didn't want to have the test. But it was things like that caused, the attitude to be quite, disrespectful in ways. And they wouldn't have the test done. Information overload. So receiving too much information at once can be overwhelming, making it hard to understand or retain information. Lack of feedback. So without feedback, it's challenging to know if a message was understood or if there are any concerns. Poor listening skills. Effective communication isn't just about speaking, it's also about listening. Poor listening skills can hinder understanding. Assumptions and jumping to conclusion. Making assumptions can lead to misunderstanding if those assumptions are correct. Why do you think poor listening skills are so important? Why do you think poor listening skills will hinder your understanding? Why do you think it's good to listen?
Because if you're not listening attentively about something, you will just say half of the conversation that went on, and the vital information that you need to pass on, you might miss it.
Yes.
Because you were not really interested in what was going on.
Yeah. And why do you think you've got to be interested? Why do you think you really have to listen?
So that you can really... Okay, she's talking.
What was that? Sorry.
If you listen properly, it may be about your treatment, about your medication, or about what next to do. If you're not listening properly, you're not be able to know what is the next step.
Yes.
Next step in line. So if you listen properly, if you don't understand, you need to get your daughter, your son, or your interpreter, or anybody that can tell you. Because some people in my workplace, there are some people, they don't really understand English. Even if you describe, if you demonstrate, they don't get it. unless maybe they're with their daughter or their son, they are very comfortable with them. They'll be able to pass the information to them.
Yeah,
so this is the next.
You have to be comfortable with everyone, don't you?
Everyone, yeah.
Yeah. But sometimes, you know, listening is the most important because you need to understand what the person's saying. 3.2, identify how to overcome barriers to effective communication. So some general things you can do to overcome these barriers are showing that you understand and aware of the individual's needs, wishes, beliefs, values, cultures, or preferences. You can support individuals in communicating their needs and communicating with them by avoiding the use of jargon. So use simple, straightforward language so they understand. Not speaking too quickly and clearly, speaking clearly. So not going really fast, you know, trying to make them understand, go slowly. Demonstrating that you are listening and interested in what they are said by using active listening skills. Sometimes if you sit there and you sound like you're bored and you start yawning, that doesn't show that you're interested, does it?
No.
Yeah.
Ensuring communication aids are working correctly. So for example, having working batteries that are available, communicating with individuals in private and quiet spaces to avoid breaches of confidentiality, ensuring the environments are comfortable and quiet to avoid distraction and support hearing, ensuring the interpreters and advocates are available where needed, and also taking time to learn about the person's communication needs and preferences, and providing individuals with clear evidence information that make decisions about their health. Why do you think it's so important to, you know, ensure that, you know, everything is kept confidential?
I think it's to build trust in the clients. To build trust.
To have what, sorry?
I said to build trust, for the client to build trust in the carer.
And what are you making the person feel like that you can that they can trust you when they're talking?
Yes.
To know that the information that they've passed to you is secured. That
secure and confidential. And it's not so you don't go and talk to everyone else about their medical health or anything like that. Applying theories and techniques. When considering how to overcome barriers to communication, you can also apply communication theories. For example, you examine whether barrier has occurred because of a message has not been encoded or decoded correctly using the Argyll's model. In Shannon and Weaver's model 1949 of communication, they refer to noise. Here, noise means that the internal and external factors can act as barriers to communication. Internal noise includes such as your own feelings, attitude, beliefs, and values. And external noise might include physical tiredness, environmental factors such as noise and lack of privacy, and barriers that affect specific individuals such as language differences and impairments, which make communication more difficult. And that is the diagram. So you've got the noise, information source, transmitter, channel, receiver, and destination. So in summary, for effective communication to take place, you need to overcome the noise. This means being aware of and acknowledging your own negative feelings or attitudes and beliefs which could affect communication, and ensuring that you empathize with the individual. This means you need to understand the situation from their point of view. Think about why you have negative feelings in relation to the individual or communication. Is it because you are stressed or because you are nervous about it? For example, planning the communication may help to overcome these things. In relation to external barriers, you should ensure that you are physically able to communicate effectively. For example, you are not hungry or feeling tired or ill. If you are, you need to be able to overcome this or postpone the communication to a better time. Remember, be honest about this. If you feel you cannot deal with it, interaction, then say so, arrange another time. Yeah, because physically you have to be, be able to listen to understand the person instead, because if you're hungry and, tired, then you're not going to be able to look at, that will become an effective barrier. The environment is suitable for communication is not too noisy, as we mentioned earlier, too public, or too uncomfortable. For example, consider the other person's need in respect as well as your own. You can meet the communication needs of the individual. This means understanding what they need from communication. So any language differences, any sort of impairments that might hamper communication, you will need to understand the individual or group of individuals and what specific needs, and take them into account when you are communicating with them. Dealing with difficult people, conflict and aggression. I'm sure some of you have dealt with people that are quite aggressive in your profession.
Yes.
And it's sometimes difficult to, you know, hold back a little bit and keep calm. But it is, yeah, because, you know, it's not something that you have to retaliate back with. You need to be more calm. It's sometimes really difficult in that situation to be like that. Sometimes the individuals you communicate will raise barriers that prevent communication. Where there's a conflict or aggression between people, this will prevent effective communication. Being able to communicate calmly and professionally is important. You should never end up shouting at someone or getting involved in pointless argument. Some ways of communication barriers are clarify the issue. So very often conflict is based on a misunderstanding, and by asking questions about what the other person thinks is a problem, the issue can get resolved quickly. Analyze their expectations. So sometimes the other person's expectations are different from that of your own. If you do not find out about and analyze expectations, you will not be able to resolve any issues. You need to understand your own and other people's expectation in order to understand them. Understand different perspectives. So you have learned throughout the workbook how people's attitudes, culture, background, and beliefs can affect their perspective on things, and how empathy is more important for effective communication. Different perspectives together with lack of empathy may cause barriers to communication. By ensuring you are understanding your own and other people's perspectives, you can overcome the barriers. Has anyone been in a situation where, you know, this has happened and you've had to stay really calm? You know, have you got an example of where that you something happened where the person became aggressive, or you know... Sorry?
Yeah, I've experienced that.
Yeah.
Yeah,
Oh, you've
I've
been
experienced
sworn at?
that. Yeah, pardon?
Did someone swear at you?
Yeah, calling you
Yeah.
names, telling you to
Yeah.
fuck, leave the place,
Yeah,
you know,
yeah,
use the
yes.
F words, all
Yeah.
that.
Yeah.
So you just have to calm and just
Yeah.
give her a
And
little
walk
time.
away
Sometimes
from
when
it
you give,
sometimes.
yeah, walk away. Yeah, sometimes when
Yeah.
you give them little time, they don't remember they've done that to you.
Yeah.
When you go
Yeah.
back, they don't remember they've done that to you.
Yeah, sometimes you have to walk away from it because you have to be the bigger person, and sometimes you have to try to talk to them and try to, you know, try to diffuse the situation, you know, try to make them understand what they're saying or is wrong, because sometimes you can get patients that are either, you know, have mental health issues, have disabilities, or maybe, you know, have a drinking, you know, habit, and then it's difficult to sometimes communicate with them kind of people.
Sometimes if they want to go out for cigarettes and they're not allowed to go out for cigarettes, there's nothing you can tell them at that moment. They won't listen to you.
Yes.
You
Yeah, that's
deprive
so
them not
true.
going out. Yeah.
Yeah. Be aware of and identify emotional triggers. So be aware and identify emotional triggers. No one wants to feel frightened, intimidated, angry, or embarrassed. And situations where one person feels any of these may mean that the communication becomes less effective. So in fact, any strong emotions such as distress and even excitement can make communication less effective. You need to be able to recognize the triggers for these emotions and the signs that these emotions may be occurring so that you can try and manage these. Transactional analysis. Communication is the basis of human interaction and is important to build a rapport and positive relationships with people. One way of understanding interactions between people is through the transactional analysis, which we looked at the transaction theory last session. and an understanding of the theory may help you to overcome some of the barriers to communication. Transactional analysis theory was put forward by Eric Berne, a psychologist in the 1950s. Transactional analysis identifies that individuals communicate from one of 3 different ego states: parent, adult, and child. The parent ego is based on taking a parent-like role in communication. This might involve helping someone nurturing parent or telling someone off critical parent. A nurturing parent might say, I'll show you how to do this time, then you will be able to do it yourself next time. A critical parent might say, you need to do this way, or don't do it like that. For adult ego, communication based on logical thought. Opinions are based on information received. An adult might say, I think we should try it this way, or what do you think is the best approach to this? The child ego is more emotional state. A child ego communicates based on what they feel. When the child ego expresses natural instincts such as happiness, excitement, is known as free child. When the child is suppressing instinct and trying to behave in a way that will gain approval from others, it's known as adapted child. A free child might say, I've been promoted, isn't it amazing? Expressing excitement. And an adapted child might say, I did my best, but I can try again if you like. Individuals adopt the different egos in interaction with others. When interacting, they will make assumptions about the ego in which the other person will respond, and they may move between the different egos, even within the same interaction. For example, A, did you manage to finish that report? Adult to adult. B, not quite. I've had the final section to complete. Adult to adult. A, I thought I told you I needed it by this morning. Critical parent to a child. B, it's not my fault. I had to take Jenny to the doctors yesterday and you didn't give me that much notice. Adaptive child to critical parent. A, do you need some help with it? Nurturing parent to child. B, it's under control. I'll finish it in the next half an hour and email it to you. Adult to adult. Berne went on to explain that some communications between individuals, such as complementary ego states, which lead to effective communication and positive relationships, and others crossed sections which are not conducive to effective communication or build positive relations. Useful techniques for resolving tension or conflict or asking questions: using the adult ego by asking for an opinion, giving information, or asking questions. Appealing to the other's nurturing parent by asking for help or advice or expressing your feelings on the issue. If you think you can talk to their child ego, you might be able to lighten a situation by using your own child ego. For example, showing your feelings, making a joke, or being enthusiastic. Bear in mind, though, that this may relieve tension, but is unlikely to take communication forward. De-escalation techniques. When barriers to communication are anger and aggression, de-escalation techniques can be useful to calm the situation down. De-escalation is a combination of verbal and non-verbal techniques. De-escalation may involve verbal techniques such as speaking to the person on a one-to-one basis, using their name, finding out why they are angry or aggressive, asking open questions about facts rather than feelings, and answering factual questions about them, ignoring any sort of abusive language or communication, as Olu mentioned, avoiding being defensive as this may make the situation worse, showing empathy and concern, speaking quietly, calmly, and staying in control, offering appropriate choices for them to move out of the situation without feeling they have been backed down. Non-verbal techniques, so open body language, minimize movement and gestures, nurture expression face-to-face and at their level, limited eye contact, so do not invade personal space, step back, and for safety reasons, have a clear access to the exit. How to check understanding. So when communicating, it's always important to check that the person has understood what is you are communicating. You can check understanding by observing facial expressions and body language, observing behavior, asking the other person if they have understood what is being communicating, rephrasing questions and asking additional questions, requesting that the other person repeats back the information understood. In this section today, you have looked at the barriers of communication and how they can affect communication, how to overcome these barriers, because it's so important you understand how you overcome them and how to check the understanding. These are the references that have been used in today's session. Find out individuals' communication language. You can actually link onto these resources and go onto them to find out more information. Looked at describing how to establish individuals' communication skills for care and communication and language needs. Further reading and further ebooks are available on Moodle that you can go onto. So please go onto Moodle. All this will be on Moodle, and your additional reading and additional resources is on Moodle.
Please, how do we go to the Moodles? Because I don't get it, please.
What do you mean? How do you go to Moodle?
Where do we go to read all this if I want to read?
It's on the module that you're doing, effective communication in
Okay,
health and
so we
social
can just
care.
search for it. Okay.
Search for
All
that
right.
module, and then what will happen if you go onto that module, you'll have any sort of ebooks, online books that you can use, any sort of journals to help you with the assignment area, but any sort of further reading as well. So you'll have things like, communicating with people, learning disability, MenCap. You'll have links on there. And then, if there's any sort of questions, you can send them to LearnerWorks at UK Varsity. So has anyone got any questions? Because we've finished today's session, and thank you for your patience. Has anyone got any questions or anything before we finish off?
Please, I want to ask a question. I don't think you've mentioned it here, but it does come up. It does come up. Why is the when your clients or your patients or your individual, some of them, they do get their letters where they are, where they stay, where in the residence home or in the hospital. You know what I mean? Why is it important to keep it? Why are they keeping it in the office? Why is it keeping in the office?
Keeping what? Sorry, the information.
Yeah, like personal letters, personal letters there. Why are they keeping it in the office? Why is it important to keep it in the office?
Because sometimes, in the nursing homes and things can go missing. So for like patients that are quite old and don't know what they're talking about, sometimes they keep their personal information and personal things in the office. They don't keep it with the person.
So it's just
the
not
reason
to get
behind
missing.
it is, sorry?
So it's just because not to get missing.
Yeah. And it's it's their valuables. Sometimes when you go into a hospital, they say that, you are responsible for your own, things going missing, unless you put them in personal possession. So, it's important that you put in personal possessions in regards to trying to keep your items safe. And especially with elderly patients, it's very difficult for them to understand anything about money and, things like that. And there's been incidents in nursing homes where, the elderly people have had money taken away from them by healthcare professionals. And also, there've been incidents where they've been abused in the nursing homes and things. So for the government and the new policies and procedures they put in place, they must feel that the best thing for them to do is put the patients things in personal possession rather than leave them with that patient. Because if they are old and if they don't understand, they're not going to understand money. I know sometimes, again, going back to my father, he had dementia, but he was on the first stages, but he started forgetting money. He started forgetting, what money was, and he started forgetting how much money, what money meant. So it was good that it was with, me or my sister. So we were able to help him. In them situations is sometimes important that, they are able to understand that, the family of the patient are able to understand that their things are secure.
All right.
Yeah, so sometimes, people will keep them because of them reasons.
Okay.
Has anyone got any other questions before we finish off today's session? Anyone know? So thank you for
So
attending.
next week is assignment discussion.
No. Not next week. Tomorrow.
Tomorrow. Oh, assignment
Yeah,
tomorrow.
make sure you come tomorrow because I
Yeah.
have on my diary saying 9 o'clock in the morning, the last session for the assignment session.
Yeah.
Okay, that's fine.
So I will see you lot tomorrow. Have a nice day and thank you for your patience.
Thank you.
Attention.
Bye.
Thank
Bye,
you.
Claude. Bye. Thank
Bye.
you.
Bye. Bye.